Hello, this is Dr. Brian Hill, and here are some video demonstrations to assist you after your shoulder replacement surgery. It is important that if you have any questions, you reach out to us to assist you. There are some precautions after shoulder surgery. We do not recommend that you reach behind your back. In addition, do not put weight through your operated shoulder. It is important that you perform these exercises 3 to 4 times a day and 10 to 15 times each. Ice is recommended after the exercises to decrease swelling and pain. It is important to move your hand, wrist, and forearm after surgery. We demonstrate wrist flexion and extension as well as forearm supination and pronation. It helps if you can find a countertop to support the arm. Elbow flexion and extension is important as well. Try to stand up straight to get full range of motion. For the shoulder, we start with shoulder blade or scapular retraction. Pendulum exercises are critical, but it is easy to do this the wrong way. You should let your operative shoulder hang and then move your body forwards and backwards, side to side, and in circular motions to get your shoulder to move appropriately. External rotation is critical after shoulder surgery. This is easiest performed while laying on a hard surface and putting a towel underneath the elbow of the operated shoulder. We recommend a stick or a broom handle, and normally this is a stretch that is limited to about 30 degrees of external rotation unless otherwise specified. Forward elevation is important also. Again, this is easiest completed laying down to have gravity assist you. The non-surgical arm should really be doing all of the work here. I thank you for watching these video demonstrations. I encourage you to follow us on social media. If you have any questions or concerns, feel free to reach out